We have an offer to help you with your Social Security plan, and we'll answer some tough questions about Medicare. I'm Erik Brenner. Join me right now for Your Wealth Health. Hello and welcome to Your Wealth Health. I'm Erik Brenner, owner of Hilltop Wealth Solutions. And as always, thanks for joining us. And if you're watching us on Facebook, please share us with someone who could use this information. We also want to thank those of you that are watching us on yourwealthhealth.com. Joining me today is Bill Davis, a private wealth advisor for Hilltop Wealth Solutions. He's in the studio with me, but we are continuing to practice social distancing. And from her office in South Bend, Sherrie Kramer, a Medicare and health insurance expert with the Sanders Agency, which is located in Mishawaka. Sherrie joins us because of the deadline for Medicare enrollment is Monday. And we also want to have some new information about Medicare premiums for 2021. So Sherrie, what is the exact time people have to have their enrollment in by on Monday? And if they miss the deadline, what are the other options that they can do?
Well, everything has to be time and date stamped on Monday by 11:59 p.m. Of course, it's better to have it done a little bit earlier than that. Kind of helps avoid a little bit of that stress. And the options are, if you miss that deadline, there really are not very many options. If you happen to have a special enrollment period, you've moved, that type of thing, you would be able to do something at that time.
Okay, thanks, Sherrie. And so, Bill, one of the things that we have seen, they have announced that the increase in Medicare premiums, which, we've got a graphic here that shows 2.7% for 2021. And so the rates start at 148.50. And, I know that we've talked some about the potential of more premiums, premiums going up even higher as the years go by here.
Well, yeah, Erik, that's a lot of people don't realize that depending on what their modified adjusted gross income is, that will drive the amount of Part B premium. And so yeah, as we've been talking on this show about doing Roth conversions and putting together retirement income strategies, a lot of people overlook the fact that there is going to be a reduction in their Social Security because of an increase in the Part B premium based on what their modified adjusted gross income is. And many times people don't plan for that and don't understand that all of those levels of Part B premium go up based on their modified adjusted gross income.
Yeah. So based on that, Sherrie, with this increase, how are the healthcare experts like yourself thinking about with COVID, how it may look going forward?
I think moving forward, we're going to have to make up for some of the costs that have been put on the Medicare system because of the $0 treatments for COVID and for the testing. And we will, as we move forward, see those premiums for the Part B premium and also the deductibles within the Medicare Part A and B increase.
Yeah, and Bill, you mentioned this, modified adjusted gross income. So, Sherrie, we pay attention to this, what we often call that IRMA, the income-related monthly adjustment amount, because, when people get, past those amounts, their premiums go up quite a bit for Medicare, doesn't it?
Yes, it does.
And so, we've got a graphic here that actually shows, if you take a look at this, that if you're a filer of a joint return, you can see that above $174,000, then your premium goes from $148.50 to $207. And Sherrie, that is obviously the first dollar fallen into that. So I know you probably talk with clients to make sure that maybe they can't avoid it, but they want to make sure that they understand those increases and how it affects their overall Medicare premiums, right?
Absolutely. It's not a very pleasant situation when people aren't aware of that. And as you go through the Medicare 101, and if you don't give them that information, they can come back with quite a surprise if they haven't paid attention to that.
So what do you think now this year? what were the biggest changes you saw in the Medicare the gap plans and the Medicare Advantage plans?
With the prescription drug plans, that has been the biggest change that I've really seen. We haven't seen a lot of the prices go up for the Advantage plans. Everything has stayed pretty stable. But we have seen that some of the drug plans have special pricing on insulin, which is a huge help for my clients and for all those who are in need of insulin. We've seen some of the higher cost drugs go into maybe a lower tier so that they're going to be a little bit less expensive. And that's been just a really big help for people.
Yeah, so that's I know you have stated in the past that, you know, it's important medication-wise, you know, drug-wise, that's kind of the core decision, right, in choosing a plan and what's best for your situation.
Exactly. And people need to be aware that every year those carriers change their formularies. So just because your drug was covered well in 2020 does not mean that it will be covered the same in 2021. I've had some plans that I've run that there have just been huge differences. So if you haven't had that checked out, it's really important to have that information looked at so you can make sure that you're in a plan for 2021 that is going to fit your prescriptions well.
You know, Bill, we talked about the premiums going up, and we've got a graphic here that shows kind of historically the chart. This was put out actually by the government, right, by socialsecurity.gov, and it shows obviously current, past costs, and then it shows some projected costs, which are some pretty high potential increases, as Sherrie said, for the future.
Yeah, it definitely surprised, I think, both you and I when we saw this data, and certainly we're going to need to adjust it in the longer term healthcare planning for our clients, in that, you know, we're talking about by 2028 a number approaching $250 a month. Multiply that by 2 spouses, we could be at $500 a month Medicare Part B premium alone, and then needing to get the supplement from Sherrie and or the Medicare Advantage plan.
Yeah. Yeah, Sherrie, so, you know, we know this is an important decision for people, and we know that you've been busy during this sign-up time, working long hours and helping your clients. So, you know, I really want to thank you for your time, taking a little bit of time out of your schedule, and you've been helpful. And if you have questions about Medicare, you can contact Sherrie at the Sanders Agency in South Bend. The number is on the screen, which is 574-345-0614. Again, that's 574-345-0614. And make sure you ask for Sherrie Kramer. Still to come on Your Wealth Health, what about your Social Security payments next year? Are they going up? Plus, we'll show you how you can save thousands and thousands of dollars when you make smart decisions about Social Security. Stay with us.
Built on a legacy 4 generations strong. Clayton Hoover & Sons Home Improvement. More than just our business, it's a family legacy.
Welcome back to Your Wealth Health. I'm Erik Brenner, the owner of Hilltop Wealth Solutions, and I'm here in the studio with Private Wealth Advisor Bill Davis, and we just finished an important segment on Medicare, and now we want to talk about Social Security. The benefits for about 70 million Americans will go up just 1.3% in 2021, and that's the cost of living adjustment for the next year. Not much of an increase, but Social Security is so important to so many people, and there are lots of critical decisions people have to make. And we have a graphic that shows some of the factors that people must consider, Bill, really when they think about Social Security and when to draw. So let's kind of talk about those.
Yeah, so we always want people to consider their health status.
Yep.
You know, and so that'll be could relate to the next bullet, which is health life expectancy, and so depending on what kinds of pre-existing conditions they're facing, what their life expectancy might be, would lead them. You know, a shorter life expectancy would lead someone to probably claim a little bit earlier. You know, do they really need the income? So you know, that's two different camps, right? Some people are like, defer because I don't need it. And but it really comes down to the design of a retirement income strategy to determine when to take it. And then, you know, the most commonly overlooked from my perspective is the survivor need. You know, so if the higher primary insurance amount is going to be whichever one of the parties it is, they could be disinheriting that other party if they predecease them. So that's we think that's just a big one that's commonly overlooked. I think a lot of people are just like, I'm claiming it as soon as I possibly can, and then whether or not you plan to work or not. So you know, you can't claim prior to full retirement age if you're going to work part time and earn more than $18,200. So it's you know, there's a lot of facts to consider, as this graphic indicates.
You know, Bill, we talked about the cost of living, you know, announced recently for next year. But, you know, I wanted to bring up this graphic because this is interesting. If we look at this from 1975 through, you know, the announcement this year with the cost of living and really what it's done. And the other thing we want to point out is, you know, the factor that, or how they determine it, is not based on an act of Congress. It's based on an index. Mm-hmm. And so over that 45-year history, the average has been 3.71%. And I'm sure that probably, you know, a lot of people wouldn't guess that. And even over the last 15 years, it's been 2.13%, and that's with some zeros in there over the last 15 years.
Right, and yeah, 2015 we had a zero. We had a zero in 2010. You know, there's no doubt that these cost of living adjustments have been going down significantly, and so we would expect that these cost of living adjustments will stay fairly low. In that, you know, we were at 2.8, 1.6, 1.3. You know, it's been declining over the last 5 years, and so you don't want to really count on. A lot of people get it confused because in the previous segment, you know, we talked about what percentage the Part B premium went up, and they go, oh, the Part B premium went up 2.7, and my COLA only went up 1.3. Well, that's two different. You know, it's not an apples to apples comparison, but still, for long range planning, you know, we use a pretty low COLA factor or none to determine how much people's Social Security is going to go up.
Yeah, that's a good point. I think, though, we want folks to know that even if you use a 2% cost of living factor, it still makes a difference over time.
Right.
And so, you know, the longer you wait or the higher your benefit, you know, even if it's a 2% average, it's going to be a higher dollar amount than if you draw it early. So, you know, there's a lot of misconceptions, so, you know, about Social Security. And so let's talk about these. I want to pull up the graphic here and talk about, you know, a lot of people don't really look at this as a pension, Bill.
And it is. Let's face it. You know, you've worked all the quarters leading up to your Social Security claiming strategy, and you have locked that in, and it is an obligation of our government to pay that to you because you've paid into it. Mm-hmm. So it is. We think of it truly as a pension. A lot of people don't think it's going to be there, and that is led by, you know, information that's shared about the Social Security Trust Fund, and that will be here. You know, with all the unemployment going on right now, I think they've said where we would start to dip into principal is somewhere around 2035, down from 2037. But we do have people, people are living longer, and that stresses the system. But we think that there'll be some legislation that will come up in the next Congress that will probably be addressing some of the longevity issues. The belief that if you claim benefits early, the benefit will go up automatically when they reach full retirement age, and that's just not true. Once you claim, you're now going to be locked in to cost of living increases going forward, and so that's why it's so important to not just pull the trigger early. And then the last common misperception is that the factors that determine maximum benefits. And so people need to know what goes into the calculation, and so we'll be jumping into some examples in the following segment that show you real life what kind of a Social Security calculator would do for you.
And that longevity issue on the graphic there, I think that is just one of the things that will continue to be a challenge because people are just living longer.
Yeah.
And so you just absolutely have to consider that. So I think those are good points. There was a recent Harris poll that shows that 80% of the people said that they would seek a new financial advisor if they could not answer the questions about Social Security.
Yeah, and I know it's a challenge for some of our peers in the business, is dependent on the relationship they have with where they work. They may or may not be able to do this kind of work, this kind of calculator, and so we feel real fortunate being an RIA, being an independent, that we've gone out and got the best calculators you can get to make sure we are providing the kind of information that's going to be most valuable for clients to be able to answer their questions. What if this? What if this? Because there's just hundreds of options once that first spouse turns 62. The options change every single month from that first age of 62. Yeah. And so that's the time to start looking at it, is when you're getting ready to approach that age 62.
Yeah, great. Thanks, Bill. So we at Hilltop invest a lot of time and money for training on Social Security, and we want to help you with your questions. We're offering a complimentary Social Security analysis. All you have to do is call the number on your screen, and that's 574-633-1476. Again, that's 574-633-1476. This offer is $500 to $1,000 value that we will underwrite for you. And we can also sign up for the offer at our website, hilltopwealthsolutions.com. We make this offer as part of our commitment to educate and give back to our community. And still to come on Your Wealth Health, we'll take a look at some common Social Security questions and a couple that just had to make those decisions. And we'll talk to the Executive Director of the Food Bank of Northern Indiana. Stay with us. Welcome back to Your Wealth Health. I'm Erik Brenner along with Bill Davis, and we're talking about Social Security. And we have a case we want to show you. So Bill, let's pull this up on the screen here. So, we have John and Sally, both of them are 61, both hoping to retire at 62. They've both been healthy with no really chronic health issues, and they believe they have adequate assets for retirement.
Yeah, Eric, and we try to use realistic examples, and I think that we've chosen some reality-based graphics here for this case analysis. So if we go to the graphic that shows the Social Security options for John and Sally, what you're going to see is if they were to both claim it at 62, John's benefit would be about $1,581. Sally's would be about $690. Most commonly, I can see that John's the higher income earner, and so I would already be thinking about that we might want to defer John. And so the first thing I would be looking at is is that Sally's benefit, is that half of John's, and so maybe we start to claim Sally's first or something like that. And then if you fast forward to 66 and 8 months, which would be their full retirement age, then we would see, John's benefit goes up by almost $800 a month, and Sally's goes up by almost $400 a month. So there's another option. And by the way, like I said in the previous segment, every single month these options change, or the numbers change every single month after age 62. So all the way up to age 70, you can see the benefits now up to $32.55 and $14.23. But so you look at those cumulative benefits on the next graphic, and what we determine is that if they both claim early, they do through their life expectancy collect almost $900,000 in total benefit. But if they just defer just a few years, you can see where that benefit goes, and that benefit goes up to $1,042,000. But the best benefit would be if they both waited till they were age 70. I kind of like to be in the middle, Eric. And so if you look at that fourth option where Sue claims early and John claims later, it gets some income coming in, some Social Security income coming in earlier in the retirement segment. It allows us to draw from some of the other pots of money they would have accumulated in, allowing John's benefit to grow to the maximum benefit, which is going to do two things. Number one, it's going to give them almost the highest amount of lifetime benefit from Social Security Administration. But more importantly to me is that if John were to predecease Sue, which is the most common situation, then he's going to leave Sue with a much greater benefit by waiting till age 70.
And I think it's important as a reminder that this cost of living adjustment we talked about before was, if you take it early, that cost of living adjustment is on a lower number. So, that's part of this impact here. And I think a lot of people, if you were to ask them about whether or not they would have thought they would have received $1 million over their lifetime,
they would never believe it.
They would have never believed it.
Yeah.
But, we're seeing that now with people. And again, with the longevity factor, it's really important. So Bill, how would you sum up, the viewers on just how they really, what's it come down to in thinking about Social Security and how they should think about it going forward?
Well, I think how they should think about it is they should get a professional opinion.
Yeah.
And so that's going to require somebody that has Social Security analyzers.
Yeah.
And so we have a couple different tools that we're, putting out there for the viewers today that, as part of our education of the community, we're offering to give them a complimentary look at this. So the graphic that you look at there is just an output from one of our tools that we use that can look pretty confusing to people, but it shows you the different steps in the Social Security claiming strategy. For example, John claims on his record at 62, Sally claims at 62, but she gets on her own record, but she gets a spousal bump up and in addition to her benefit. And going to really the last of that graphic of the maximum lifetime nominal benefit is pretty common strategy that we would utilize, and that's Sally claiming on her own record, which will be lower, and then John claims on his own record later, and then she gets a bump up later, and that's going to give her the maximum survivor benefit if John were to predecease her at age 83. You see her benefit's $4,200 a month when she's 83 years old.
Yeah.
I mean, that's pretty significant.
That's pretty significant.
Yeah.
So people just really need to, again, think about it as a pension decision.
Well, yeah, because what it could have been if he would have claimed early, John would have claimed early, and it was what, $1,300, and
Yeah.
that got COLA.
Yeah.
You know, she probably would be living on half of what what she's going to have based on strategy number 5.
Yeah.
So the way I would sum it up is that people should take advantage of the offer, get us their Social Security statements available at ssa.gov, and then we would provide some output for them.
Yeah, great. Thanks, Bill. So we want to help you with your Social Security questions. We're offering a complimentary Social Security analysis, and that's about a $500 to $1,000 value, and we're going to underwrite the cost for you. So if you're interested, please call the number on your screen. That's 574-633-1476, and you can also sign up on our website at hilltopwealthsolutions.com. That offer is part of our commitment to giving back to our community as our efforts to help local charities, especially during this holiday season. Our staff has volunteered at several nonprofits in the area, and we've given thousands of dollars over the years. And one of the organizations we always try to help is the Food Bank of Northern Indiana. And today we are joined by Executive Director of that organization, Mary Jo Martinick. Mary Jo, really appreciate and respect the work you're doing and how difficult it's got to be in this global pandemic. And we know you cover a large area. How big is that area?
Yeah, we cover 6 counties in northern Indiana. So we cover the middle part, which is Elkhart, St. Joseph, and LaPorte, and then Kosciuszko, Marshall, and Stark County. So the middle part of northern Indiana.
So share with us, Mary Jo, would people be surprised by the demand for food these days?
Well, the pandemic has definitely changed how we're doing business. We keep lots of numbers and statistics, and from October of 2019 compared to October of 2020, a 354% increase in the services that we provide. What the pandemic did was kind of expose something nationally that we've known for a while, that there are a lot of hungry people that live in our communities all across the United States.
Besides food, Mary Jo, what else is the food bank in need of?
We need volunteers, but we're extremely cautious about letting people into our bubble because of the pandemic. So food, cash, and volunteers are what is most needed right now to help us get through this crisis.
So what are some of the food items that you need the most?
Yeah, shelf staples that you keep at home, things like macaroni and cheese, peanut butter and jelly, boxed meals, pancake syrup and mixed, canned meats such as chicken and canned tuna are good. Things that soup right now is really good, and ravioli as it gets colder. So things that people can use to kind of stretch and make meals with what they may have at home right now would be very helpful.
Great. Thank you so much, Mary Jo, for your time today. If you want to find out more about the Food Bank of Northern Indiana or have questions about how you can help, call them, or you can go to their website at feedindiana.org. As we mentioned, the Food Bank of Northern Indiana is one of the organizations we at Hilltop work hard to help, and we are also involved with Gleaners, Pet Refuge, Toys for Tots, and the Beacon Health Foundation, just to name a few. For our clients, we'll match 25% of your donation to some of these organizations. So you can visit our website at hilltopwealthsolutions.com for more information. Well, that's all the time we have for today's show. For Bill Davis and the entire Hilltop staff, I'm Erik Brenner. Thank you so much for watching this morning, and we'll see you next week. Until then, stay wealthy, Michiana.